If you or someone in your family has knee pain or knee arthritis, you've probably heard many opinions: exercise more, lose weight, injections, surgery, knee replacement. Most patients are confused not because information is missing, but information is fragmented. This channel exists for one reason: to help you understand knee arthritis before choosing any treatment, not to sell fear, not to push surgery, not to promise miracles, only to explain what is happening inside your knee in simple, logical terms. The biggest mistake patients make is starting treatment without understanding the problem. Knee arthritis is not one disease, not one cause, not one solution. Two patients with the same x ray can have completely different pain progression and outcomes. That is why one doctor says exercise helps, another says avoid it, one person improves with diet, another does not. It is not because someone is wrong, it is because the biology inside the knee is different. On this channel, we will break knee arthritis into clear pillars: inflammation, joint biology, movement, nutrition, repair and preservation, and when surgery is truly needed. Each video will answer one question at a time without overwhelming. Before you panic, before you rush into injections or surgery, start by understanding. This is your start here video. The next videos will go deeper, step by step.